Hi, Jacklyn. This is Leia Santiago. Thanks for your video. I would like to address your question. There is, in fact, a controversy about that. Most of the time, I've heard that many therapists don't give an advice because it's a good way to avoid malpractice. This is not a good way, in my opinion, to go by. This is not a way to govern your practice. When a client, if they ask you for advice, well, you shouldn't tell them what to do. That's not advice. But I do believe that we should offer guidance. One good way of doing that is asking more questions. I was watching Dawn's video, and she mentioned that she felt like the therapist could have asked, "What do you think would happen if you did that?" So sometimes I do believe that advice is acceptable within a certain um, within certain parameters. It's not something that, it's not how the therapy should go. You should not be telling your client all the time what to do. But sometimes there are steps that we need the client to take in order to get to where we need. Joseph Rauch, Rauch. He is the author of Teach Me How to Die, and he also writes for um, Talkspace. He writes for Talkspace, and one of his texts is actually exactly about that, what therapists should do when they're asked for advice. And I agree, I tend to agree with him. If you as a client ask for advice directly to your therapist and your therapist denies it, look for another therapist. And here's why: you have to be able to relate to your therapist and trust him or her enough that you will trust their judgment. I mean, that's not the basic parameter, the basic standard of therapy. That's not how it should be guided. But at one point or another, you should be knowledgeable enough, insightful enough, and personable enough, know that person for a while, and have already developed a relationship with that person in order to allow you to do that. You should not offer advice, which is the other way around. You see the difference? If they ask you for advice, you let them know that it would be, you work with them asking, what do you think would happen if, saying, oh, I don't know, let's take Brittany for instance. She says that she doesn't want to be the whiny friend, but she needs someone to talk. And what Dawn said is the therapist should have asked, what do you think would happen if you crossed that threshold and you asked for more than the friendships had to offer at that point? My point of view is exactly that. You have to give advice in the form of tool to let your client discover the advice for themselves. It's not do this, do that, this, but it's more like, okay, so let's go over what you're asking me. What would happen if you did? What does happen when you don't? How do you feel that you could address this? Do you have any amongst your friends, do you have any of your friends that you think you could trust them more, or by knowing what's going on in their lives, maybe you could feel more comfortable in relating to them what you're feeling, because friendship is a two-way street, and the relationship between the therapist and the client is also a two-way street. So in my opinion, my humble opinion, I'm not there yet. I'm studying just like you. But what I think is, if a client asks for advice, guide your client to find the advice within themselves. And if that's not possible, and if you feel that you have been in the field long enough, that you are insightful and knowledgeable enough, when you trust your own advice, then I think that you can humbly approach the client and partake, uh, in part knowledge. It's different than say, here's what I would do if I were you. That is giving advice. Now, if you put scenarios based on what you know, based on what you have studied, based on many other clients that you may have seen, and what worked and what didn't for clients in a similar situation, then you could guide your client through questions, through scenarios, and help to get to that point. I hope I have answered your question. I hope that we can interact again.